lesson on client care and the body systems. You should have finished reading lesson 2 in your workbook. This video does not cover everything in your workbook, so it helps if you read it first. The purpose of this lesson is to give you some general information about how the body works, stuff related to tasks you might be delegated to do. I find it helpful to know why I'm giving someone a medication and what it's doing to their body.
We'll discuss 9 major body systems and the effects aging has on each of these systems. Remember that this information is for educational purposes only, not for diagnosis. For any of the disorders we cover, you should talk to the delegating RN about the symptoms, treatment plan, and your specific responsibilities. This is the longest video you'll have to watch, so bear with us. We're going to cover 9 body systems. Can you name them, Sherry?
Cardiovascular, respiratory, integumentary, genitourinary, gastrointestinal, endocrine, nervous, musculoskeletal, and sensory.
Great job!
Yeah, but how do they all work together? It's mind-boggling to me.
Let's start with the cardiovascular system, because without that, nothing else works right.
Cardiovascular. Cardio means heart, and I think vascular has to do with the veins and arteries. So cardiovascular is about the heart and pumping blood through the body.
The heart is a large, hollow muscle that pumps blood throughout the body. It has 4 different chambers. Leading from these chambers are blood vessels.
Vessels are for carrying things, so blood vessels must carry blood.
You've got it. Blood vessels are a network of soft, flexible tubes of different sizes that are located in every part of the body. Arteries carry blood oxygen away from the heart, and veins carry blood back to the heart.
Blood traveling away from the heart is rich in oxygen, and blood traveling back toward the heart is carrying carbon dioxide.
Blood can also carry nutrients, antibodies, and waste products.
What happens to blood vessels as we age?
Generally, things just slow down. The blood vessels lose some of their flexibility, and the heart doesn't pump as effectively. This causes less blood to be pushed through the heart with each contraction and relaxation.
Obviously, this slowing down can cause some complications.
There are 6 major disorders associated with the cardiovascular system. A very common disorder among the elderly is hypertension or high blood pressure, and it means just that. The pressure on the artery walls is high. It's important to note that often a person will have no symptoms at all and doesn't even know their blood pressure is high.
That's kind of scary. What should people do?
Regular checkups. And then there is hypotension, which is low blood pressure. This means there isn't enough pressure for normal blood flow and oxygenation of the body tissues. Congestive heart failure is another common disorder of the cardiovascular system. This happens when the heart is not strong enough to pump blood throughout the body. The result is that blood gets backed up in the veins and in body organs like the liver and kidneys. A myocardial infarct, MI, or a heart attack, is when a blood vessel within the heart closes up or is blocked, preventing blood and oxygen from getting to the heart muscle. Now, the final cardiovascular system disorder I'm going to cover is a stroke or brain attack. A stroke occurs when there is a rupture or blockage of a blood vessel in the brain, depriving parts of the brain of blood supply. The medical term for a stroke is cerebral vascular accident, or CVA.
Okay, so blood travels throughout the body delivering oxygen and picking up carbon dioxide. But where does the blood get oxygenated, and how does it get rid of the carbon dioxide?
That's done in the respiratory system. Fresh air is inhaled into the body and carried to the lungs. The rest of the body gets oxygen from the cardiovascular system. As oxygen is delivered to the cells of the body, waste gases are picked up and carried back to the lungs, where they are exhaled from the body.
So we breathe in the oxygen and breathe out the carbon dioxide.
That's basically how it works. As we age, the lungs also lose some of their flexibility. As a result, there's less breathing capacity.
An older person doesn't breathe as deeply as a younger one.
That's right.
What are the most common respiratory disorders that we should know about?
There are 4. Upper respiratory infections, pneumonia, chronic obstructive pulmonary disease, and asthma. Upper respiratory infections, or URIs, include the common cold, sinus problems, sore throat, runny nose, and tonsillitis. These infections can be caused by either a bacteria or a virus. Bacterial infections can be treated with antibiotics, but a viral infection has to run its course. Pneumonia is a more serious infection and is an inflammation of the lungs. The person may simply be less alert or unusually confused. As pneumonia progresses, mucus becomes thicker and it's harder for the person to breathe. The pain causes a person's breathing to become shallow and rapid.
Pneumonia can be very serious and requires close supervision. If you have a client with any of these disorders, be sure to talk to your delegating RN about how the condition relates to the delegated task that you are doing.
Pneumonia, colds, and sore throats are diseases that a person usually recovers from fairly quickly. Other respiratory problems, however, begin very gradually and can last a long time, becoming chronic conditions. Chronic obstructive pulmonary disease, or COPD, is a progressive and irreversible condition where the client's lungs have difficulty expanding in and out when breathing. Chronic bronchitis and pulmonary emphysema are examples of COPD. They're most commonly caused by smoking. Many people with COPD require inhaled medications and oxygen therapy. Another chronic respiratory disease is asthma. Generally, older people are more susceptible to respiratory disorders. Now let's move on to the integumentary system.
Skin.
Exactly right. The integumentary system includes skin, hair, nails, and the glands embedded in the skin itself. The skin consists of 3 distinct layers: the epidermis, the dermis, and the subcutaneous layer. The epidermis is the outermost layer and is made of tough, flat cells that are constantly being shed and replaced.
The epidermis forms a barrier against bacteria and moisture, holding water in to keep the body tissues from drying out. If this layer is broken by a cut, scratch, or a pressure ulcer, then bacteria may attack the deeper tissues.
The dermis is just beneath the epidermis. It's made up of connective tissue and has many tiny blood vessels and nerve endings. The dermis also has hair follicles, oil and sweat glands for lubrication and temperature regulation, and sense receptors that tell the brain when pain, pressure, heat, or cold occur.
The deepest layer is the subcutaneous layer, a combination of fibrous and fatty connective tissue. It's a kind of padding that holds it all together.
Right. The fibrous tissue attaches the upper skin layers to one another and also attaches to the skeletal muscles. The fatty tissue holds in body heat and acts as an insulator against cold.
I'll bet that aging affects the skin.
Yep. The epidermis becomes thinner, paler, and more translucent as we grow older. The dermis and subcutaneous tissues experience decreased blood supply. In addition, the amount of subcutaneous fat tissue also decreases, so arms and legs become thinner.
What about wrinkles?
The skin becomes folded, lined, and wrinkled. It also has a diminished ability to maintain body temperature.
And that's why my older clients feel colder.
Aging also results in nails becoming dull, brittle, hard, and thick due to a decrease in the blood supply to the nail bed.
What can we do to help our clients take care of their skin?
Keeping the skin clean and dry will help keep it healthy. In addition, you should routinely inspect your client's skin. After moving a client, check for sensitive areas that remain red after pressure or weight has been removed.
Soiled skin should be cleaned as soon as possible.
After bathing, extra care should be taken to minimize irritation and prevent overly dry skin. Water that is too hot and harsh soaps tend to dry the skin out. Use creams or oils and avoid cold or dry air. Another important way to protect your client's skin is to see that they shift their position frequently. When you're helping your client move, reduce friction on the skin by lifting rather than dragging.
Are there certain things you would recommend we don't do?
Don't massage the skin over bony parts of the body, and avoid using donut-shaped cushions. These tend to cause more pressure damage in fragile areas of the body.
How does diet affect your skin?
A balanced diet with high amounts of protein, calories, and fluid is very important to keep skin healthy and for helping wounds heal as well. If a client is unable to eat a balanced diet, your delegating RN may suggest nutritional supplements.
What skin disorders should we be aware of?
There are 8 that I'd like to talk about: pressure ulcers, stasis or venous ulcers, arterial ulcers, rashes, burns, skin cancer, dehisced wounds, and fistulas. Pressure ulcers are also called decubitus ulcers or bed sores. Pressure ulcers form where bone causes the greatest pressure on the skin and tissue, squeezing them against an outside surface. The lack of blood flow destroys the tissue. Many things can weaken the skin: too much moisture, dryness and cracking, irritation by urine or feces, or friction. When clients spend a lot of time in bed, pressure ulcers typically form on the lower back below the waist, the hip bone, and on the heels. For clients in chairs or wheelchairs, the exact spot where pressure ulcers form depends on the sitting position. Pressure ulcers can also form on the knees, ankles, shoulder blades, back of the head, elbows, and spine.
Which makes sense. If a client is in the same position most or all of the time, that creates a great deal of pressure in some areas.
Exactly. And that's why it's so important to pay close attention to those hot spots and elsewhere on the skin. Bed sores can occur very quickly, even within an hour or two.
That fast?
That fast. Clients who sit in chairs and are unable to move are at greater risk of pressure sores forming quickly because of the amount of force on the skin. Sitting up causes more pressure on some areas than if you're lying down.
Oh yeah. I can feel that just from sitting here on this chair. I've never really thought about it, but I know I get tired of sitting after a while.
As you grow older, your skin becomes more vulnerable. Furthermore, if your client has had ulcers before, they're at greater risk for developing more. Some chronic illnesses, like diabetes, can actually decrease the person's ability to feel pressure.
What are some things we can do to prevent pressure ulcers?
If your client is confined to a bed, a special mattress that contains foam, air, gel, or water helps to prevent ulcers. The head of the bed should be raised very little and for as short a time as possible. Avoid lying directly on the hip bone when lying on the side. Use pillows or wedges to keep knees or ankles from touching each other. Put them between the knees, not under them. Choose a position that spreads weight and pressure more evenly. Pillows may also help. If the client is completely immobile, put pillows under their legs from mid-calf to ankle to keep their heels off the bed. Never place pillows directly behind the knee. If your client is confined to a chair or wheelchair, use foam, gel, or air cushions to relieve pressure.
Again, we need to make sure clients don't just sit without ever moving. Keeping the pressure off will decrease the likelihood of bed sores as well. Even a small amount of wiggling helps to avoid pressure spots.
Good point, Sherry. Obviously, it's important to try to catch these ulcers in the early stages of breakdown. Any type of open wound requires special care.
The workbook goes into some detail about the various stages of skin breakdown. Stage 1 is when there isn't any broken skin, just redness. Isn't this the only type of breakdown we don't need delegation to treat?
That's right. As soon as you notice any broken skin, notify the RN. The sooner you start treatment, the faster the wound will heal.
I've always wondered, what is the healing process for wounds?
Healing occurs through 3 main processes. The first is inflammation, where the body reacts with an increase in blood flow, creating redness. Specialized cells are being sent to protect the affected area. The second process is granulation, where new tissue starts to grow to replace damaged tissue. Once the skin grows back to cover the open wound, the healing has entered the final process, epithelialization. Wounds must be kept moist while the skin around the wound should be kept dry. Sometimes changing a dressing will remove dead tissue. If further dead tissue needs to be removed, that should be done by a healthcare practitioner.
That's a lot of information about bed sores, and it's only the first of the skin disorders we're covering.
True, but pressure ulcers are common within the population you work with and are preventable. We don't need to spend as much time on the rest of the disorders of the skin.
Okay then, what's next?
A stasis or venous ulcer is a chronically open oozing area caused by poor circulation from the legs back to the heart. You'll see staining of the skin around the ulcer, which most often occurs on the lower legs and feet. Arterial ulcers are also known as diabetic ulcers and are round, open areas on the feet and lower leg. This is caused by decreased blood flow from the heart to the legs. Rashes are defined as raised, red, bumpy areas on the skin that are often itchy. Skin infections are caused by a break in the skin, like a scratch, where bacteria have taken hold. Burns can be caused by hot objects or liquid, by fire, the sun, or electricity. You should always notify your supervisor or the delegating nurse when you see that a client has been burned. Burns are classified according to how deeply the skin is damaged.
With first-degree burns, the skin is reddened and may be swollen and tender. There are usually blisters, intense redness, pain, and swelling in second-degree burns. The most serious are third-degree burns, which involve all layers of the skin.
Skin cancers can easily be seen on the skin. 90% of skin cancers are little pearly bumps that will bleed, scab over, heal, then bleed and heal up again but not go away. These usually don't spread and are treatable. A more dangerous kind of skin cancer is melanoma. Melanomas are irregularly shaped and may be described as a strange mole or a mole that is changing. Dehisced wounds are surgical incisions that have opened up and need to heal slowly from the inside out. A fistula is an abnormal tunneling that connects parts of the body that are not normally connected. Sometimes there is drainage from the fistula, such as bowel contents or other body fluids. These are symptoms you should discuss with your RN and provider. Next, let's talk about the genitourinary system. This system consists of 2 kidneys, 2 ureters, a urinary bladder, the reproductive organs, and a urethra.
This system has 4 major functions: cleaning the blood of waste products, regulating the amount of water in the body, regulating the acid and mineral balance, and reproduction.
The urinary system is fascinating in its efficiency. It works like this. Our kidneys produce urine by filtering blood. Urine is carried via 2 tubes, called ureters, into the urinary bladder. It collects here and is then expelled outside of the body via the urethra.
Does aging cause changes in the genitourinary system as well?
Aging affects each of us differently. In general, as the structure of the kidneys changes, they become less effective filters. In addition, we see less blood flow to the kidneys, less muscle tone in the bladder, a smaller bladder capacity, and sometimes difficulty emptying the bladder. The kidneys need more time to process medications.
There are 3 common genitourinary disorders that we should be aware of: enlarged prostate, urinary tract infection, or UTI, and incontinence.
The prostate gland in men is located between the bottom of the bladder and the top of the penis. When this gets enlarged, it can block the flow of urine. This can make it difficult for men to start urination and to completely empty their bladders. A UTI is an infection of one or more parts of the urinary tract. This is more common in women than men, and people may have no symptoms, or they may have symptoms like increased restlessness, confusion, or just not seeming like themselves. Incontinence is the inability to control urination, and there are 3 major types: urge incontinence, stress incontinence, and overflow incontinence. Urge incontinence is when there's a loss of urine as soon as the client feels the urge to urinate. Stress incontinence is a loss of urine when the client exercises or moves in a certain way. Overflow incontinence is when the client may feel that they never completely empty their bladder.
I like it when they're called things that make sense. Overflow incontinence. The bladder feels like it's going to overflow. That's a whole lot easier to remember than things like myocardial infarct or subcutaneous glands.
Those medical terms can get pretty long and complicated, but the more you hear and use them, the more natural they become. It's almost like learning a new language, understanding all this medical terminology.
I kind of like learning it, really. What's next?
The gastrointestinal system: mouth, stomach, and intestine.
How food is changed into fuel for our bodies. So what happens when I take a bite of pizza?
We get most of our nutrients from the food we eat, but in order for the body to use these nutrients, it has to break that bite of pizza down into a liquid form so that the nutrients can be absorbed into the body. Most of this work is done by enzymes. This is the complicated gastrointestinal system, or GI tract, at work. First, we chew our food, breaking it into small pieces. It mixes with saliva, making it easier to swallow. Enzymes in the saliva begin to immediately break down the food. Then we swallow, and the food moves down the esophagus into the stomach. While sitting in the stomach, the food mixes with more enzymes, breaking it down even further. Then the food, which is now fairly liquefied, moves out of the stomach and into the small intestine, where intestinal and liver enzymes are introduced. The liver produces bile, which is stored in the gallbladder until it's needed for digestion. Bile is necessary for fat absorption. Nutrients are absorbed through the walls of the small intestine, which is about 20 feet long. The pancreas also releases a digestive juice into the small intestine. All of the digestive juices work together to break down the food into nutrients. Food that cannot be broken down or absorbed moves into the large intestine, or colon, in a semi-liquid state. In the 5-foot-long colon, most of the remaining fluid is reabsorbed into the body. Peristalsis moves the remaining solid material into the lower part of the colon, where it collects until expelled through the anus as a bowel movement. Bacteria living in the intestine produce gas that is also expelled.
5 feet of colon and 20 feet of small intestine. That always amazes me.
It is amazing. There are also some age-related changes associated with the gastrointestinal system.
There is an increase in stomach acids, but mostly there are decreases in taste buds, chewing capacity, nutrient absorption, bowel muscle tone, and sphincter tone, and mobility in the intestine, which explains why so many of the clients I work with will have trouble with constipation.
People usually have a bowel movement about every 1 to 3 days. Failure to have regular bowel movements is of concern when it causes a client undue strain or makes them uncomfortable. It can be especially problematic if it threatens to block the intestine. A more severe disorder is fecal impaction. This is caused by long-standing constipation and dehydration. Certain conditions can increase the likelihood of fecal impaction: prolonged bed rest, taking a medication that causes constipation, or being nutritionally depleted. Hemorrhoids are another common disorder, especially in elderly clients. Hemorrhoids are varicose veins in the rectum and can be internal or external. They typically develop due to strain while defecating, constipation, prolonged sitting, or childbirth. A gastrointestinal ulcer is a soreness or tissue breakdown in any section of the GI tract. The final GI disorder is GERD, or gastroesophageal reflux disorder, commonly known as heartburn. What happens is that when a person chews and swallows some food, the stomach starts to produce acids and enzymes to digest the food. When the food and acid mixture goes back up into the lower esophagus, it causes that hot feeling of heartburn. This most often happens in the first 30 minutes or so after meals.
Okay, what's next? The endocrine system?
Right. The endocrine system is made up of glands that secrete chemical substances called hormones into the bloodstream. These hormones regulate and control body activities or growth. Some of the endocrine glands are the pituitary, thyroid and parathyroid, adrenals, pancreas, ovaries, and testes. In healthy people, these glands produce specific hormones when the body needs them. The most common disorder of the endocrine system is diabetes mellitus, which occurs when the pancreas fails to produce enough insulin. Without insulin, the body cannot properly use sugar to fuel the body's cells. Consequently, the sugar, or glucose, stays in the bloodstream and is excreted in the urine.
Diabetes is a very serious health problem and can cause other problems if not treated properly. There are 2 types of diabetes mellitus. Type 1 is often called juvenile diabetes because it usually begins at a young age. The client with diabetes type 1 needs to take insulin by injection. The second type of diabetes mellitus is type 2, which usually has its onset in people over the age of 40 and is typically less severe than type 1. About 90% of people who have diabetes have type 2. It is common in people over the age of 40 who are overweight and have poor eating habits. Other factors are heredity and stress.
In type 2 diabetes, the pancreas does produce insulin, just not enough of it, or the body isn't using it properly. As a result, glucose derived from food builds up in the blood. Some people with type 2 diabetes can control their blood sugar by following a special diet that their medical provider has recommended. People who have type 2 diabetes take oral hypoglycemic medications or insulin by injection when diet alone cannot lower blood sugar levels sufficiently.
How do the hypoglycemic medications work?
They stimulate the pancreas to produce more insulin and help the body use insulin more efficiently. They are not insulin pills or a substitute for insulin, and they only work for those clients whose pancreas still functions.
Can you explain about blood sugar fluctuations?
Well, blood sugars vary within each one of us. This is not a problem unless the blood sugars fall below 70 or rise above 200.
Below 70 is hypoglycemia, and above 200 is hyperglycemia. Hypo meaning low, and hyper meaning high.
Exactly. And you know how you can get really hungry and you start feeling weak, kind of spacey?
Yeah, and I can get downright cranky.
Well, people with diabetes have even more severe symptoms of both hyper and hypoglycemia.
So when taking care of clients with diabetes, it is really important that they eat regularly and in moderate amounts.
A dietitian can work with a client to design an appropriate diet based on their likes and dislikes. Other things to be aware of include the condition of the client's skin, especially the feet and legs. They should avoid clothing that restricts circulation.
Be aware that physical activity influences blood sugar. When doing a new or unusual activity, have the client carry a form of fast-acting sugar.
Encourage the client to wear a medical alert diabetes bracelet or necklace. It could mean quicker help if they were unable to speak for themselves.
Follow your nurse delegation for glucose monitoring, taking time to record the blood glucose level precisely.
Low blood sugar can be a very dangerous emergency situation. The delegating RN, you, and the client should have a plan in place for what to do when your client has low blood sugar. The only other endocrine problem we'll talk about is hypothyroidism, or low thyroid. This is a fairly common condition in the elderly and is easily treated with synthetic thyroid hormone.
If a person feels run down, has dry and itchy skin, brittle and falling out hair, and constipation, it may not just be old age.
That's right. It might just be hypothyroidism. There is a very simple blood test to check thyroid levels.
Okay, 3 more systems left. Let's talk about the nervous system.
The nervous system is the coordinator of all the body functions and is what enables us to see, hear, smell, taste, and touch.
The brain is the master of your universe. It gets messages from the spinal cord telling it what's happening to the rest of the body. The brain interprets these messages and then decides how to respond. It seems like some days my brain reacts more quickly than others.
Well, as we get older, there is a decrease in the number of nerve cells. The amount of cell loss varies in different parts of the brain, some areas being more resistant. Transmissions at the nerve endings do actually slow down a bit throughout the entire body. The primary nervous system disorders that you should be aware of are seizures and epilepsy, Parkinson's disease and other tremors, Alzheimer's and other dementias, and traumatic brain injury.
That's a lot.
Well, it sounds tougher than it really is. We'll start with seizures and epilepsy.
Don't you have seizures if you're epileptic?
That's right. Epilepsy is actually defined as a set of disorders that causes seizures. But seizures don't necessarily indicate epilepsy. They can be the result of head injury or some other unknown cause.
What exactly is a seizure?
A seizure is a sudden increase in the electrical activity in one portion of the brain. The seizure can stay in one area with specific and localized symptoms, or it may spread to the entire brain, resulting in loss of consciousness and shaking of the body. Although there are several different types of seizures, the 2 major ones are petit mal and grand mal. A petit mal seizure is short in duration and is accompanied by loss of awareness. A person experiencing a petit mal seizure will display minimal movement, often making them hard to detect. The grand mal is a type of seizure that is noted for its intensity and duration. A grand mal seizure usually includes a loss of consciousness, tongue biting, loss of bladder control, and shaking of all extremities. This is followed by a period of sluggish responsiveness, slow deep breathing, and confusion, which may last anywhere from 15 minutes to several hours.
Sounds pretty traumatic.
It certainly can be, and exhausting as well. Parkinson's disease is a slowly progressive disease of the central nervous system. Parkinson's often causes tremors. Tremors can also have other causes, such as brain trauma or medication side effects. Dementia is a progressive disease caused by the destruction of brain cells. There are several types of dementia. Alzheimer's is the most common. Symptoms begin with memory loss and progress to the person's inability to do daily activities or recognize familiar people or places. A traumatic brain injury is an injury to the brain from an accident, an assault, or a fall. It can also result from a lack of blood supply and oxygen, such as after a near drowning or cardiac arrest. Symptoms depend on which part of the brain was injured and how severe the injury was.
There really is a lot to know about how the human body works and what to look for when things aren't going the way they should.
That's right. The next system we're going to cover is the musculoskeletal system, which consists of the bones, joints, muscles, ligaments, tendons, and cartilage. This system protects the internal body organs, provides a framework for the body, maintains posture, and makes body movement possible. Joints are places where bones are joined together. Bones allow for movement, large ones for large movements and small ones for smaller movements. Flat bones in the spinal column protect soft tissue. Some muscles are attached to the bones and actually make movements occur. Other muscles, like the heart and intestines, work automatically. Ligaments are tough bands that hold joints together. Tendons are strong elastic bands that attach muscles to bones. Cartilage is tissue that is found in joints to allow smooth movement.
I know some things can happen to this system as we age. Joints stiffen and muscles become weaker.
Bones lose calcium, which weakens them and makes them more prone to breaking. Very gradually, the spinal column compresses and we become shorter, but regular daily exercise can help maintain muscles and joints. I want to tell you about 3 disorders of this system: osteoporosis, arthritis, and fractures. If your client has one of these disorders, discuss the symptoms, treatment plan, and your specific responsibilities with the delegating RN. In osteoporosis, bones gradually become so weak that they can break from something as minor as a sneeze. Osteoporosis can also cause low back pain, stooped shoulders, and the loss of height.
Doesn't it mostly affect postmenopausal women?
For the most part, that's true, but men can get it as well. There are ways to prevent osteoporosis, including eating calcium-rich foods or taking supplements and doing weight-bearing exercises. Arthritis is the inflammation of joints and can be any one of several types. The 3 most common kinds are osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis is the most common. The joints enlarge and their linings wear out from use. The bones begin to rub against each other, causing pain and inflammation. Rheumatoid arthritis can affect people of all ages. The immune system, instead of protecting the body, works against it. Joints become enlarged and very painful, and other parts of the body may be affected as well. Gout mostly affects men over the age of 40. The main symptom is very painful toe joints. It can affect other joints as well, but is most common in the toes. A fracture is a break in a bone. It's treated by putting the bones into their normal position and keeping the area stable. This can be done with a cast or by putting screws, pins, or plates into the bone.
We're on the final stretch. The last system is the sensory system, which includes the eyes and ears.
The eyes and ears are 2 of our 5 senses. Other sense organs are the nose for smell, skin for touch, and tongue for taste, but we'll focus only on the eyes and ears.
With age, the eye reacts more slowly to changes in light. The eyelids may get droopy and not close as tightly, and there may be a decreased amount of tears. Age can bring changes in the ear's ability to conduct sound and in the functioning of the little hairs in the ear canal.
Common disorders of the eyes include cataracts, dry eyes, macular degeneration, glaucoma, and diabetic retinopathy. With cataracts, the lens of the eye slowly becomes opaque. Dry eyes are just what they sound like. The person doesn't have enough tears and feels like there's something in the eye. Macular degeneration occurs within the eye and causes decreased vision. Glaucoma is a buildup of fluid pressure inside the eye that can lead to blindness. Diabetic retinopathy is a complication of diabetes. It damages the retina inside the eye. Common disorders of the ears include hearing loss, tinnitus or tinnitus, and dizziness or vertigo.
Hearing loss can be caused by a number of things, including long-term exposure to loud noise.
Tinnitus is ringing or buzzing in the ears and also has a number of causes, including exposure to loud noises, ear infections, or side effects of some medications. Dizziness, or vertigo, is quite common in the elderly and may be due to many things and involve multiple body systems.
There's so much to know.
There sure is. I hope you use your workbook to help you remember all of this, or look things up when you have a question. Many factors affect a client's health: medications, complications of disease, and normal aging. So it's important to know as much as you can. I hope this has been helpful, but please, if you have any questions, talk to your delegating RN. Make sure you understand everything you've been asked to do.
That's it for the body systems lesson. Way to hang in there.